In thinking about social determinants of health and how organizations, communities, coalitions can really meet that challenge, unfortunately, I don't think that there is enough evidence about the ultimate goals and the outcomes of their activities. So in this Getting Further Faster initiative, what we decided to do is sort of take a backwards look or a retrospective look and identify communities, coalitions that had actually had success and then learn from them. In the areas that we're particularly interested in, including things like food security and connections to clinical care, and in some cases actually had some very hard outcomes, like clinical outcomes that we were interested in. Each state is different, but there are threads that bind us together. There are common things that we learned in this process and that we shared across all of the participants. Things about how coalitions can be as effective as possible, about the strategies that they might be using to address the issues that they identified, how they engage communities, and how they're looking at their outcomes and evaluating their processes. I think the first element is really whether or not these coalitions are addressing the real conditions that surround health, these upstream factors.
Avondale had one of the highest infant mortality rates in the nation, and so we wanted to make sure that we were hitting infant vitality and addressing that infant mortality rate. But when we started to do that, we noticed all of these other social determinants of health impacting infant vitality. So we were looking at the infrastructure, the availability of food within that community, and the availability of jobs and transportation and access to care, and so many different elements of health that were impacting infants and pregnant people within the community. And so our partners all shared the same end goal of improving infant mortality rates, but what we realized were there were so many different elements to infant vitality that we had to hit on first. And so our shared values became addressing all the different social determinants of health, and so those community members could thrive.
The second part is really building the appropriate partnerships, the right partnerships, bringing together the variety of organizations, government, non-governmental, to really think through how you're going to approach these problems and then keeping them at the table.
We have council members who are actually on our coalition, governmental entities, Cincinnati Health Department, Waterworks. We also have healthcare institutions, so hospital systems, children's hospitals, nonprofit organizations, Cradle Cincinnati, the YWCA, the YMCA, just several different organizations working together to really change racial equity and to deliver on a promise that we are all better together and that we're stronger together.
The third area is making sure that you have the real community voice at the table. Not simply, we're going to give them lip service, but really understanding members of the community who live these scenarios on a daily basis and what they think should be prioritized.
We invite in the health champions that we've worked with, the community builders, and through the Avondale Children Thrive Coalition, we invite in the health champions from that coalition into the health department to have a co-leadership role. And they are part of our Live, Work, Play coalition. They help do our subcommittees and work on food equity, active living, infant vitality, tobacco-free living, kind of all the staple social determinants of health. And so we get the voice of the community and we're able to use that in our community health improvement plan, our community health assessment, but then full circle, we're able to put that back out to the community and say, hey, these community members helped us develop these programs, and with their voice, we were able to impact infant vitality and impact your built environment.
A lot of people in the Avondale community usually have a lot of barriers. They addressed a lot of things to me about things they deal with. A lot of the times there's a lot of broken trust. And one thing the community builder said that was extremely important is we can't be coming into the neighborhood without connecting with the resident leaders that's in the community. That was astounding to me. It was very important to be a voice to the people in the community and also be trained in being a leader as well. It was me learning a lot of the technicals and the quantitative and qualitative data that I need to know to make the changes. I had to learn that to make things change for the people.
One of the important learnings that we gained through the GFF project was about sustainability, and in particular, recognizing that money is critical, but the human factor is probably more important in the long run.
One of the things that we've identified as a key piece that is necessary for sustainability is staffing ratios. And so this is really thinking as a team with primary care, our team, and other clinician leads about who is necessary at food pharmacy and how much of their time is required. And what is that patient to staff ratio that allows for that magic to happen at food pharmacy. And for us, we haven't found the answer yet, but we are in those deep conversations that are going to allow us to move the needle and actually make institutional change.
So from my perspective, having public health at the table is paramount. They bring data, they bring know-how, they understand how to convene organizations together, and sometimes they're your conduits for financial resources. I think one of the unique attributes of public health is that they can actually make policy. And in some cases, they are the one group at the local level, for example, and the state level, that can actually drive health policy. Similarly with healthcare, they're often taking care of a very similar population. Again, now that they're very invested in doing these social needs screening, we need to understand what they're seeing in their patient populations. What excites me about this is the energy, the teamwork. I'm a person who really thinks that when people are gelling, when their ideas are gelling, when they're thinking together, that's an exciting moment in time, and that is often where you see progress being made. So from my perspective, having run these coalitions, having been part of these coalitions, watching them succeed and sometimes fail, to me, it's very hard to even imagine doing work any other way when you're talking about these big root causes, these big drivers of our health outcomes.